Commencing in April 2017, the Ministry of Ghana, supported by development and implementing partners, initiated a process to procure and implement the LMIS that supports the availability of the right health commodities when and where beneficiaries will want or need them. To implement an LMIS that provides optimized holistic plans and proactive action recommendations to inform supply and demand planning activities. Automate all business processes used in the management of a full logistics and supply chain management lifecycle of healthcare commodities, and to create a single logistics management information system that supports all logistics functionalities and adaptable to the needs of individual MOH entities.
Moving away from paper-based systems and accepting the ELMI's use was quite challenging initially, but with effective collaboration and involvement of all key stakeholders and the change management efforts put in place, we have been able to surmount this challenge, especially when we have a lot of people born before computer.
Until recently, the Ghana public health supply chain has been confronted with some challenges. The supply chain reforms, which brought on board some interventions in addressing these challenges, included the last mile distribution, procurement framework contracting arrangement, logistics management information system, which is the GhiLMIS, and we're also looking at the warehouse improvement processes. Central to these reforms is the Ghana Integrated Logistics Management Information System.
In 2017, Global Fund engaged GhiLMIS to implement the Ministry of Health Logistics Support Project. The project was designed and budgeted and co-funded by both USAID and the Global Fund.
The key tenets that drove the implementation range from establishment of governance, ensuring alignment with e-health architecture, fostering ownership from inception, and building key pillars for sustainability.
In 2017, the ministry conducted a landscape assessment of the various logistics management information systems that were being used in our facilities. We realized we were having over 100, and most of this data was not portable. There was no standardization, there was no visibility. We can't even look at stock out, expiries. So the logistics management information system was designed to help address all these challenges. The health sector now have a clear strategy to move towards data standardization and interoperability of systems. So the GhiLMIS is a solution that have the capability of interfacing with every system. So currently, the GhiLMIS is interfacing with the drone system. This system enhances data exchange, standardize data, enable reporting and real-time access to data. At the end of the day, there is information available which enable the ministry to make informed decisions and policies that impact patients' gain.
The central medical stores receive commodities from donors, and the government of Ghana procure items which come to the central medical stores. We check the quantities on the documents against the physical quantities with the inspection team with the accompanying documents. The items are then received in GhiLMIS with the batch numbers, the expiry dates, and then the batch quantities. One of the key things the system does is also stock taking. GhiLMIS also gives us opportunity to do quality assurance. Because GhiLMIS gives us the opportunity to receive items in lots with their expiry dates. When there's an issue with the lot, you'll be able to trace a particular lot to the RMS or the facilities which that lot was issued to.
In the GhiLMIS platform, we have a function called the replenishment sensing reports. The replenishment sensing report gives you your average monthly consumption, your daily consumption data, your reorder quantities, your maximum stock. So with this, the system itself proposes quantities that will be required to meet your maximum stock level.
As a supply manager, consumption data is very, very critical because this helps us to decide as and when we need commodities to refill our stocks. Previously, it was very difficult coming up with consumptions because after issues, you need to take your time, do your entries, and before you are able to tell what have you consumed over the period. It was taking a very long time, more than 1 week before you are able to consult all these various documents to be able to put this information together.
In order for a requisition to reach the regional medical stores, you needed to fuel an official vehicle, sometimes pay per diem for a driver and a technical officer if need be, and then all these were costs that were being incurred by the facility.
But with GhiLMIS, the system just gives you everything at the click of a button. Less than 2 minutes, regional medical store knows what you want.
I can see what I'm being given at the regional medical stores and what I cannot have from the regional medical stores. And with that, even before my commodities arrive at my facility, I can initiate other alternative processes to get those very essential commodities.
In fact, GhiLMIS has also really enhanced collaboration within the facility. Not long ago, I quite remember early last year, my boss traveled, and that particular month, in fact, we didn't get our goods because I finished preparing my requisition. My boss, to approve it, he wasn't around. But this time, whether he's traveled or he's around, at a click of a button, my request gets to him and he approves it and we submit. This collaboration is not only within the facility, but also between the facility and the region. It can happen, region is requesting for a report on something at the facility here. On the GhiLMIS, there's a feature of which you can just submit your report to region without physically traveling there. One other beautiful thing about this system is that in the course of using, in case of any little problem, just a dial of number, they will solve your problem for you. So this paperless something has really come to help us.
If the replenishment plan is used, GhiLMIS is able to let us know whether the stock that they are requesting for will be over their warehouse capacity. So in case you would need to reduce the quantities, you'll be right away be able to know. You will also know your buffer on hand. So based on that, you can promise the quantities of the product. Then the order moves to the warehouse for warehousing processes also to begin.
When the order has been approved, and then you want to generate the pick list. Once I log into the system, the first feature that you see is the location of the product, the batch number. You would find an expiry date of that particular product you want to pick from the warehouse.
At first, we just enter any storeroom because we didn't know the very location the particular item is. With all the information that is seen on the pick list, it helps us to save more time and it makes our work more easier because we know the particular room we are going at point in time. We just enter, we pick the items.
Based on the routing plans and then the picking and the packing that we've done, we consolidate the shipment. Whatever stops the vehicle will do on the road, you arrange them on the GhiLMIS. You can also print the proof of delivery to the driver. Formally, when a driver moves, you wait, then there hasn't been any feedback. But now with GhiLMIS, as soon as he gets to the facility, once the facility receives the product, an alert will be brought onto the system to ascertain that truly the driver has gotten into the facility. It has given us an idea as to the number of hours the driver will get to a facility.
With the capability of GhiLMIS to monitor temperature of our cold chain items, both in storage and in transit, ensures that the integrity of our cold chain items, including oxytocin, is maintained right up to the point of being issued to our clients, and in this case, our pregnant women.
With GhiLMIS, the right commodities get to the right facility at the right time in the right condition.
Tremendously, it has come to improve services. We get a lot of clients who are also satisfied from our services that we provide because informations are given beforehand. Sometimes we can inform them that maybe we don't have, say gauze, we don't have these consumables. So kindly give us a week or 2 days, we may have it.
And then my Baba hospital no pay. And draw was some in Sankano, you didn't know mammy. Many Japan, if it's a first nearby and drain be a while in Sankan, you call outside.
Since June 2019, that the GhiLMIS officially went live, operational inefficiencies across the value chain have greatly impacted positively. Today, when we talk about real-time logistics, operational and transactional data for the system, it is generated by a click of a button.
This system has come at the right time to help resolve some of our issues, and we are happy to have the system in place.
My involvement in the area was driven especially by what I came to meet, and there was pressure on me from Global Fund to deliver, and I had no option than to deliver.
I would want to take this opportunity to thank the Global Fund especially for supporting these interventions, and of course our USAID Global Health Supply Chain Procurement and Supply Management Program for the technical assistance, as well as all the staff, MOH, GHS, and anyone who has played a role in the development and deployment of this system. We will do our best and ensure its proper utilization.